Hi everybody, welcome back to Hormones and Health with Dr. Heike. So what sort of symptoms do people get when they have high prolactin? In the case of women, irregular periods or absent periods, headaches, low libido, abnormal breast milk production, therefore producing breast milk and without a positive pregnancy test. This is called galactorrhea. And visual problems. So if you have a prolactinoma, this is the growth in the pituitary gland. If this is large enough, it can start to sort of compress the surrounding structures, and this leads to compression visual pathways called the optic chiasm. So if we suspect a high prolactin, how do we need to go about evaluating? What are the tests that we need to do? So first of all, prolactin, it can be measured as a simple blood test. We also want to check the thyroid function test just to make sure there is no underactive thyroid. We'd want to ensure that the kidney function is all normal. And we'd also want to check the other pituitary hormones, as there may be problems with the other pituitary hormones as well. We'd then want to move on to doing some sort of imaging. An MRI scan of the pituitary would be essential. And this is to assess if there's any structural abnormalities, and particularly if there's anything compressing the surrounding areas. Now, another really important test to do would be a DEXA scan to assess bone density. That studies have shown that people with a high prolactin or hyperprolactinemia can have 25% bone density loss. And this is essentially when prolactin is raised, it suppresses our ovulation and suppresses the amount of estrogen in the circulation. And we know how important estrogen is in terms of bone health and bone density. Therefore, a high prolactin level can interfere with bone density. Therefore, it's really important to get a DEXA scan done, especially if you're in a situation where you've had abnormal periods or no periods for a long period of time. We're talking about maybe 1 year. If you like this video, don't forget to like, subscribe and share. If you want me to go over any other topics and any more details that you found of interest, please comment down below so I know what topics you'd like to see next. Thanks for watching Hormones and Health. See you next time. Bye.